Good morning. Thank you for joining us for this week's live Q&A with Dear Pandemic. We are so excited this week to be welcoming a very special guest, Dr. Chloe Gibbs of the University of Notre Dame, who is going to be joining us today. She's an education economist, and she's going to be taking all of our very sticky questions about schools and COVID. So thanks for joining us, Chloe.
Thank you guys so much for having me. I'm a big Dear Pandemic fan. I've learned a lot from the Nerdy Girls over the past few months, so I'm very delighted to be here.
Oh, that's so nice to say. Thank you.
And I have the opportunity to offer Chloe a little bit more formal of an introduction because she's too humble to read her own credentials out. So I am going to do that for her, brag on her a little bit. So Chloe is an education policy scholar on the economics faculty at the University of Notre Dame, where she is a faculty fellow, and I'm actually going to read this because I didn't get it right when I practiced, for the Institute of Educational Initiatives and the Wilson Sheehan Lab for Economic Opportunities. She is an extensive writer, both in scholarly spaces and policy spaces on education and child, family, and issues in general. Notable for our purposes this morning, she keeps a wonderful weekly blog that updates all things kids, data, and COVID during the pandemic on a blog stewarded by the Indiana Clinical and Translational Sciences Institute. Link dropped below. I consider it my one sort of must read weekly to keep up with what's new on the data on schools and spread and all things education writ large. We are really excited today, not only to welcome Chloe, but to welcome her on behalf of Dear Pandemic and our partners, Impact for Healthcare and Bump Club and Beyond. So again, warmest welcome to my friend and grad school classmate, Chloe. We are delighted to have you here.
Thanks, Lindsay.
So Lee, do I get the pleasure of asking the first question, or do you?
I think that you get the first question, but before we do that, let me just say that we have gotten literally hundreds of questions about schools and COVID. And so I want to thank our readers for submitting all of their terrific questions to our question box, which is on our website at dearpandemic.org. We don't take questions out of the comment box on these live chats. You have to go to our website and put them in the question box because we have to look up the answers. And in the case of the school questions, we're so excited to have an expert here because these ones really are particularly tricky. So please go over to our website and do that. And thanks for all the questions that you already submitted. We have 4 really good questions for today. And Lindsay, you are first up to bat. So go ahead.
Terrific. All right. Kate from Tacoma, Washington. Thank you, Kate, for writing in. Now that we have nearly completed the fall term of school across the country and world, what do we know about the safety of having kids in school? And what do we still not know? Is it true that transmission does not appear to happen at school? Is that restricted just to younger children or true for teens as well? Chloe.
Just a small question.
Just a small question, but it's the burning question on everyone's mind.
Kate's question is the $1,000,000 question, right?
Right.
So I think to get started, I think I want to characterize sort of 2 dimensions of the evidence and sort of what we're learning as kids are returning to these settings. Some kids are returning to in-person settings. The first is to think about spread that's happening within schools. And we have some evidence that I'll talk about on that dimension. And then the other is to think about spread that's happening outside of schools, but potentially is related to the fact that in-person schooling is happening. And so I think those questions very much related, and we have some evidence emerging on both dimensions. So we will drop a link to a really nice summary from the AAMC of kind of what we know at this point. As Kate said, we're sort of building this body of evidence as we have more time to learn from what's happening. I will say that on the question of spread within schools, it does seem that schools are not the site of significant spread. In the few cases where we have nice evidence where we can see sort of an index case in a school, and then there's very good contact tracing around that student or staff member, and we can see sort of whether others within the school building contract COVID, we don't see significant spread in those cases. So this is evidence from Germany, which sent kids back into schools in the summer months, from daycare settings in the US that were consistently in operation, and not just for little kids. They were often serving older kids of essential workers. And so some evidence from there. And then a really recent study out of the UK that just came out this week also uses this kind of approach. So I would say pretty consistently in the best evidence we have about what's happening within schools, not a significant amount of transmission, but I want to add some important caveats to that. These are in contexts where there is consistent and ubiquitous use of masks for the most part, distancing, reduced capacity, so smaller group sizes, ability to distance, and so I think when we think about sort of whether this generalizes to other contexts, we really need to think about sort of the setting in which it was studied. The other thing is, you'll note that this evidence is emerging from the summer months, and we might think differently about that as we head into the winter months, where we're indoors more, ventilation becomes more important. In these settings, it was possible to distance, but also possible to be outside and have windows open and that kind of thing. So I think that's important. The other dimension that I mentioned, the spread outside of schools, that I think is really important to thinking about this. And I think about this really in two ways. I think about both spread that could be coming from kids being in school. So this is, kids going home and potentially spreading to adults in their household, or staff members being in the building and potentially spreading outside of the school. There's another dimension of this that I think is important, which is that the return to in-person schooling could also just sort of signal to people more of a return to normalcy. People could engage in other activities as we're sort of returning to school buildings. It certainly facilitates parents being, sort of more out and about if their kids are back in in-person schooling. And so we could also think about sort of the ramifications of kind of the signal that in-person schooling sends to people about sort of what their level of activity should be out and about in the community. And I would say this evidence, though we don't have a lot of it, suggests that there does seem to be some increase in rates in the community when schools return to in-person. Couple of caveats there. It's very hard to separate that from other policies that are potentially happening at the same time, because as we all know, many of these things kind of unfolded as a bundle. So as states return to various levels of activity, they might open schools for in-person instruction at the same time that they increased capacity for dining in, or something like that. So it can be difficult to separate these things out. I think there has not really been a message of like opening schools to the exclusion of all other activity. So it's difficult, but I just want to point that out because I think those two things could be happening simultaneously. Not a lot of spread within schools, but that the return to school does seem to correspond to elevated COVID rates in the community. So within the building, I think with the right mitigation strategies in place, spread does not seem to, schools do not seem to be super spreader sites as of now. The other sort of key point I'll make to Kate's very good question is that, schools are part of communities. There are very high rates of COVID infection in communities right now. They're sort of part of communities in lots of ways. Those kids and everyone in the building goes back out into the community. Schools often serve a lot of roles in their community in terms of making sure kids are fed and mental health services and all kinds of things like that. So we're sort of weighing all of these pieces together. There is some recent evidence from several of the dashboards that track cases in schools. These are state-based dashboards, or there is the school response dashboard that is nationwide. Not all schools contribute to these dashboards, so that's an important limitation of the data. But recent numbers in these dashboards suggest that staff rates might be starting to sort of peel away from the community infection rates in the communities in which schools are situated. So I think that should give us some pause. We should be worried as we see community infection rates rising, and the fact that staff rates seem to sort of be outpacing those rates right now in some places. That gap is not as wide in places that have reduced capacity, significantly reduced capacity in in-person schooling and masking. But we should be paying attention to that. I think especially as we're heading into these winter months, people are indoors more, and rates are increasing, generally. We really have to think about that interrelationship of schools and the communities they're situated in.
I think that's a really interesting point that, we don't have good observations of places where schools opened for in-person instruction and nothing else changed at the same time, right? That is the heart of what makes it so hard to figure out if what is happening within schools exclusively of everything else that's, the concurrent situation elsewhere.
Yeah, I think given the evidence on spread within the school building, if we had prioritized that, if we had thought about sort of opening schools to the exclusion of other things, if the message had sort of been, this is the priority and we need to focus on that, we might be seeing different, the numbers I just talked about sort of what's happening in community rates and with staff and school building rates. We might be seeing a different story there right now, I think.
Yeah. So
can I ask a clarifying question? So I feel like when we talk about this and we're in conversation about this, saying that something's not probable doesn't mean that it's not possible. So for example, we saw a big outbreak in an Israeli school context, so I do think that sometimes we have to be really careful here. Like whether something is probable or whether it's possible are very different things. And I would just love for you to sort of talk about the difference, right, between like the fact that an event can end up in a numerator of a rate of whether or not it's likely to happen versus the denominator.
She said numerator. I knew it. She was going to say denominator.
Right. So if we think about the rate, the probability of whether something's likely to happen, right? There's both something happening and then there's all the other events, that do and don't happen. So if you could just sort of speak to like whether it's possible versus whether it's probable. Just to get some context.
Yeah, so, and this is a good point because I pointed to a few studies that I think are sort of the highest quality of what happened when people were back in school buildings. You mentioned the Israeli event, and certainly we've seen news of particular isolated outbreaks. And so what we might be seeing sort of on average is not necessarily the experience of every single school or district or setting in these data. And I think that's really important to point out because I mentioned some of the sort of common factors across the settings where we see low rates of spread within schools, some of the commonalities there, using masks, the distancing, the lower class sizes or sort of reduced capacity. And so, I think it's certainly the case that these bad events happen, spread within schools, outbreaks, spreading beyond the school. So kids taking COVID home and spreading to family members or that sort of thing. And so, what I think we try to look for is like, what are the conditions that could be in place to reduce the likelihood of those bad events? And also you mentioned the Israeli case. I sort of want to loop back to Kate's question because she did ask about age groups.
Yeah.
And it is the case. The Israeli outbreaks were largely among older kids, and also some of the practices we've been talking about were not in wide use when they reopened schools in the summer in Israel. But it does seem to be the case that younger kids are inefficient spreaders relative to older kids, and so that might be contributing to the fact that we see generally lower spread among like elementary age kids. But also, again, difficult to disentangle because we also know that the older kids might be engaged with their peer group outside of school. And so there could be other places where it's getting passed among older kids that are not the school setting with the full set of mitigation strategies in place. Younger kids, at least in my experience, they're not going out to parties as much
right.
in the elementary grades and whatnot.
Thank you, Chloe. Malia, you have the pleasure of the next question.
I do. So next question comes from Monica in Montgomery County, Pennsylvania. And Monica asked us, what are the risks for my elementary school kids to go back to in-person school right now? Should I keep them home?
It's a tough question, a challenging question. These are tough choices that we're, parents are navigating. So I'll start by saying that I think there are some things I can say about the data, the evidence, what we're learning that might be relevant to this calculus that parents are engaging in, but that parents obviously know their families the best, and they know about their children's health history. They know about the sort of risk factors within the household, and so that all has to come into play when sort of weighing these decisions. And so your family pediatrician is going to sort of be the best source when thinking about your child's specific situation. But here's sort of how I think through it as a parent and as a data scientist. And I'll also note that the CDC has a helpful tool an interactive tool to kind of help parents walk through some of these questions. So we will also, I think, drop that in the links. So here's how I would come at this question. First, what are the schools doing? So what is in place? And what are the, so first, sort of what is the modality of instruction? Is it some sort of hybrid arrangement? Are younger kids going back, older kids? So what does that look like? What mitigation strategies will be in place in the school? And so I would, really start there at assessing my confidence in the school's approach to preventing spread within the school. Ventilation, distancing, a lot of this has to do with kind of the facility. Does the school have room to distance kids? Lots of school buildings, the school building stock in the US is quite old. And so particularly in urban areas. And so we might be worried about ventilation in those cases. How will they handle tracing, quarantine, isolation when cases occur? Because I think one thing we've learned from the dashboards is that cases will occur in schools, particularly now when we see community rates at what they are. And so what is the school's plan for how that will be handled and communicated to parents? So I think if I was then confident with what I hear on that front for what schools are doing, then it moves to thinking about your family situation. And I actually have learned a lot from you guys and Dear Pandemic on this, sort of thinking through the layers of interaction we have, or sort of how big our circles are. So, how locked down are we otherwise? And so is sending my kid to school sort of the one way in which we will be out in the community, or the primary way in which we will be out in the community? And if those mitigation strategies I just talked about are in place, then maybe we're comfortable with that level of risk. Or, are, parents in the home, essential workers, they're out in the community all the time, and the kids would be going to school, so I think thinking about sort of, how big the circles get once we engage in these activities. And then certainly, what is the risk profile of everyone in the family? And so if your child were to bring COVID home, and let's say that, you're not particularly worried about your child's health status in terms of contracting COVID, but maybe you are worried about grandma who lives in the home, or somebody works in the home somebody in the home works at a place where they're interacting with high-risk individuals. So, it's important to remember that with kids, we know they generally don't get as sick as adults. Many of them are asymptomatic even when they contract COVID, but we're still learning about the long-term effects for them. Many of us have heard about the multi-system inflammatory disease, and we're still learning about what that looks like in kids, which is presented in some kids. So I think, on that dimension, we're learning that the science is evolving all the time. One of the big lessons, of course, of COVID is really about these decisions not just being about an individual's exposure, right, but about being all the people they come into contact with. So, there's some early evidence, some early data at the beginning of the pandemic that about 35% of adults in the U.S. have some connection to schools. So, a large portion of the population has within household direct contact with somebody who is going into a school-age child.
That's first degree contact, right? That's not even the second degree.
Yeah, that's not even thinking of outside of the household. Exactly. Around 50% of all school employees are in the sort of higher risk categories for more severe COVID. And there's 40 million adults in the US that meet the criteria for increased risk that also have that direct within household connection to schools. So So I think it's a many-layered decision as you kind of walk through these pieces. You have to think about the decision-making that's happening at your district or school and what they're doing. But then you really have to think about sort of what the risk profile of your own family, your own household is.
Chloe, can I make a plug for one additional consideration? So it's interesting. So Chloe's an education policy analyst and I'm a health policy analyst, and we're both parents. So I think, it's really interesting. I learn a lot from you. And I think my health policy lens, the first thing I think about is how much disease is there in my community before I think about what the school is doing or what my personal risk profile or household risk profile. I think because I deal in health statistics all day, every day, my very first criteria is the amount of circulating disease in the community, because here in New Hampshire, we were lucky for a long time to have low circulating disease. So if there weren't ideal conditions in a school, and if your family didn't have a lot of risk factors, a lot could be forgiven in terms of, these sorts of choices, but we don't have that luxury now. So
yes, thank you for highlighting that. And I should have mentioned that is in the CDC tool, one of the first steps. So like when you're walking through your own decision-making with using their interactive tool, they start with the community, they move to what the school's doing, and then they move to sort of thinking about your own household situation. So yeah, thanks for
well, and thanks for mentioning this tool. I think I'm going to write about that tool this week for my editorial calendar slot. So thank you for the idea and the inspiration.
Of course.
All right. So we have a lively discussion going on in the chat. And I just need to remind everybody that we don't take questions live out of the comment box here, the chat box, because we like to look up the answers in advance of telling you anything that we want to make sure that we give you good info here. So
we're nerds,
because we're nerds and we
study.
need to do our homework. So if you have a question, and I know you have a lot of school questions that we are not going to get to today, please go put them in our question box, which is on our website at dearpandemic.org. Okay, so Lindsay, you've got the next question. Oh no, I have the next question.
Yeah.
No, you have it. Just kidding. Your turn.
So I'm going to pivot us a little bit. I think we probably only have time for one more question, right?
I wonder, so we kind of tackled question 3 already. Yep. Can we just do a real quick job of it?
Yeah, so, and I would actually like to reinforce this. So Matt from Madison asks, what are the best practices that we've learned from schools that have been meeting in person? And I really want to, for those who have just joined or for those,
and I want to drop this link too. So, we talked about this a little bit already, but could you just summarize all by itself, what are these best practices beyond, what's the level of community spread? What's happening in the schools that it seems to be working?
Yeah, when we look at schools and some of that evidence that I mentioned, so we dropped a link earlier to the recent AAMC summary, and then there's another nice piece that's from earlier in the pandemic, a science article that will also drop that summarizes some of these lessons, particularly from other countries that went back into in-person schooling sooner than we did. And the evidence, I'd say, across these different contexts really shows that distancing is important, reduced capacity is really important. So having these smaller group sizes, being able to spread kids out, consistent use of masks, so student masking, in addition to staff masking, hand hygiene and respiratory etiquette, as always, cleaning and disinfection, but really also robust contact tracing systems that identify cases and isolate those cases and family members of those students so that it can be contained and controlled, seems to really be important. And I think this has been a struggle in the US context because testing has not necessarily been as quick to facilitate the kind of sort of very quick identification and isolation that we see in some of these best practice studies.
And I think, one thing that we've been seeing even amongst just the team, the Nerdy Girl team, is that there seems to be a threshold where testing and contact tracing just can't keep up. And the number of people who are home on quarantine, staff members who are home on quarantine, makes it impossible to keep going to school in person. So there does seem to be some kind of a threshold effect there in terms of what is possible, how much mitigation is possible in terms of tracing and quarantining.
And related right back to the community infection rate point, right? I mean, once we get to a point where it's very widespread, it's going to be hard to maintain.
Absolutely. Yeah, exactly. Okay, so I do have the last question here. And this one is a doozy. Joanne from San Diego, California asks us, so in light of all this conflicting evidence, should children and adults attend schools in person? And I want to invite the two of you to have a conversation about this because, I'm an epidemiologist, and when people ask me this question, should schools be open in person? I have started saying, ask a policy person. This is a policy question. It's not a science question anymore, really. So the two of you are policy scholars.
So this is a doozy. But I thank you for that that setup, Malia, because I think this really is like policy making is about balancing competing priorities, right? And I think one thing we've been talking a lot about spread and what we know about COVID spread in and around schools. But when we think about in-person schooling, there's lots of other benefits and that we consider. There's costs of the different modes or shifting around in different modes. And so a parent making this decision is weighing a lot of those things as well. So, we have the school administrators, school officials weighing lots of things to make these decisions about who goes back, when, for how long, what are the sort of triggers or thresholds at which we make a different decision. And then we have parents also engaging in that decision-making process and weighing those things. So there's a lot of other, we're not gonna have time to talk about learning losses and mental health and socialization. There's lots of other things we're thinking about when we think about the importance of schools in kids' lives. And so, it's a really difficult decision, but I would say, sort of to the point Lindsay made earlier, we start with sort of what have we done about the public health crisis? And are we at a point where in our own community that is sufficiently under control to think about the school decision? And, I would argue that, we should probably be thinking about schools as a priority, even if that means the exclusion of other kinds of activities we may have been engaged in our communities, or we may want to engage in, but maybe should forego. So, I think that's really the tension here, is kind of balancing all of those things. I think the public health concerns are paramount, but they are weighted against all of these other, I would be remiss not to mention the fact that we see mothers exiting the labor force en masse during the pandemic. And so clearly families are having to make very tough decisions about how to manage what they're dealing with in their homes. And so, schooling does play a childcare role for families. And so I think, all of these pieces are coming into play as families are making these decisions.
And I'll just make a plug. I wrote about this a little bit last week on Dear Pandemic, and I wrote a post about what science can and cannot do with respect to being an input into policymaking. And we here as nerdy girls, and me and Chloe as PhDs in public policy, we're really good at calling the balls and strikes on the data, as Dr. Mike Osterholm says. That's what we do. We are good at getting a very quick landscape of all the people who have something to win and something to lose. We call those stakeholders. We call the balls and strikes on the data and the science. And then in my last job, what I used to do was convene work groups of stakeholders. So in this situation, it would be parent representatives, teacher representatives, PhD types like me who are data dorks, and anyone who has something to win or lose about this conversation. And you bring them together in conversation, and you bring up the data, and you bring up issues of ethics and equity, and then someone has to make a decision. But the data can really only take us so far. And I think Chloe and I, as PhDs in policy, probably have a lot of humility with respect to what data can and cannot do, because we end up in these sticky policy situations really for a living. So I will end with a note of humility about what we nerds can actually say.
Exactly.
Excellent. Well, Chloe, thank you so much for joining us. This has been enlightening, and I know our readers have tons more questions, but I hope that that answered at least a few of the big ones. We had a really hard time picking questions to ask you for this week. So thanks to all of our readers for watching and for the lively discussion. We invite you to follow our page. We're a team of doctorally trained scientists and clinicians who have been curating COVID information on social media for the last 10 months now, and we're going to keep doing it. So if you have a question, we will be back next week to tackle more live questions, and you can submit those in the question box on our website. I saw many questions in the chat that should go in our question box so that we can plan on answering them in the next week and also on next week's live. And that's at dearpandemic.org. And in the meantime, everyone, I hope you stay safe and stay sane.